dentist, and they were tested at birth and at 1 year old, and then now it's coming up on their 2 year birthday was 2 weeks ago.
Okay.
So my family has told me that their speech is delayed.
Okay.
And my husband and I can't tell. So he is deaf with no amplification. I'm deaf. I have a cochlear implant. So we mainly use ASL at home and outside the home, but almost all of our family is hearing. So they get a little exposure with our hearing family there, but at home it's all ASL.
Okay.
So I'm just worried about they'll be starting school soon in 3 years, but I just wanted to get some information now and see what I need to do to help them later.
Yeah, I think you came to the right place, definitely. How is their signing as opposed to their speech? Do you think that they understand speech as well as they understand sign, or do you think they understand one more than the other? What is your take on that?
They don't use their speech a lot, and my husband and I, we don't push them or encourage them to use their speech at all. So maybe they don't understand it, but like I said, I can't tell exactly.
Okay. Yeah, that's no problem. Well, we definitely would like to, I would personally like to maybe do some assessments with them. Since they are 2, they are probably slightly behind, not as much as they would be if you'd come later, so don't worry about that. But if we do want to do some assessments of their expressive language and their receptive language, and also probably to do with their articulation, because what they hear from you is, since you do have a little bit of the delayed speech as well, since you do have a cochlear implant, which is totally normal, what they hear from you as opposed to their hearing peers or family is going to be a little bit different. So they might be speaking a little bit on less articulately, which we would like to see them do. I definitely think there's a good chance that they'll be able to catch up by 5 years old if they start doing therapy with either, we could do it with a speech therapist or a deaf educator or a oral habilitationist, whatever we'd like to do. I'm glad you came to us with your concerns. We'll definitely do whatever we can to help them. I actually have a early intervention oral habilitationist down the hall if you'd like to go with me to see her right now. Good.
Yes.
Awesome.
Please. Let's go.
Do it.
Thank you.
Hey Kayla, how are you?
Hi, good. How are you doing?
Good. This is Mary Beth, who I was telling you about. I sent you over her case synopsis.
Yes, absolutely.
Earlier.
I've already read over it.
Awesome. Well, I'll just let her tell you about her boys.
Yeah, go right ahead.
Okay, hi. I'm here today to talk about my twin boys. I'm mostly worried about their delay. I've been told, my whole family has told me that their speech is just delayed, and I've obviously not been able to notice. But I just want to make sure by the time they start kindergarten that they are just equally level with their hearing peers.
Absolutely.
I'm just worried that I maybe can't help them a lot with that side. I just don't know what to do.
Well, how are they in the home environment?
We primarily use ASL.
Okay.
My husband is Big D deaf, so I may not have his exact support with introducing a hearing culture to him. I've been doing some research, and I saw something that said about a bye-bye method,
Yes.
Bicultural, bilingual. I just want to incorporate, I want to be a part of their hearing culture as I want them to be a part of my deaf culture as well. So I was hoping we could bring the two together, and I'm just not exactly sure how to do that.
so glad that you are for that approach, because while I was reading over your case, that was one of the approaches that I wanted to recommend to you, because I feel that because your twin boys are hearing, they are already going to have to be a part of the hearing community, but because your husband and you are also involved in the deaf community, I was going to recommend that approach because it would be the best of both worlds for them. So what we can do is the first and most important thing is that we should not stop the use of ASL in your home, because that is the foundation to their language right now. But I would recommend that we start adding more English into their everyday life. And you can do that by, while you're cooking, start speaking more, in addition to continually signing, or just showing them new sign words in incorporation to English as well while in play or, in daily routines.
I can definitely try to talk more around the house. Would that help?
Yes, absolutely. Don't you agree, Kayla?
Yeah, I think since they'll be using both ASL and English to communicate pretty much for the rest of their lives, whether it's with you guys or other people in the deaf community, and of course their aspect of the hearing world, it's important for ASL to be the foundation of them learning the English. So you can definitely help in that way more than anyone, I think, since usually which way we go with this is therapy. We do speech therapy with them, whether that includes a deaf educator or just whoever we implement there, whatever we feel the boys need the most. So they will be basically doing the same thing. We'll probably at first have an interpreter in there to help with the signing, as well as when they're hearing what they're, they have all these hearing peers they're going to need to understand. So they also need to have that foundation of the sign language, which you can 100% help with, as well as your husband. And he can definitely be a big part of that deaf community being implemented, as well as just the deaf culture in a general sense. And also, I want to suggest that we want you guys as parents to help learn strategies to stay close with your children and bridge that gap within that hearing and deaf world, because that's a big part of it is that a lot of people overlook is the parent involvement and the parent's intervention, so to say. So you kind of get an intervention at the same time as your boys do in that way, because you and your husband, of course, you have somewhat a little bit of the hearing world aspect in you. You know how to function in it, but you pretty much associate with the deaf community, right? That's pretty much yes, you and your husband. So we definitely want to be able to bridge that gap, especially with your husband, if you think that you don't think you'll have as much support with him. So we just do whatever we can to help you guys with that, definitely.
And in addition to that, high levels of family involvement are strongly correlated with high levels of positive language outcome. And I know that you said that majority of your family is in the hearing community. So if you could get their help in that, if they would be willing to be more involved into your children's, educational and just, everyday life, that would strongly increase their vocabulary and their use of the English language.
Definitely. And it's also important that the parents are active in the advocacy for the boys and themselves in this process throughout the entire thing. Whether we're going to have to do our assessments to see and go throughout the years if they're going to need this pass when they get into public schools, because it may be that we've got this so early that the boys will be able to catch up rather quickly, especially with their already knowledge of an existing language. It's not like they're acquiring language, period. I really want you to understand that you did a great thing by teaching them sign, and that though they might not be speaking right now or have perfect speech, that will come in time, and that the signing is a great foundation, and that they already have language and understand what language means. It means that they can acquire it. They have that ability. So we just want to habilitate them into the speaking aspect of it, not as much as the language aspect of it. It's kind of hard to explain sometimes, but they just seem to be just as involved in the hearing community as the deaf community with your boys. And the best ways for them to function in both worlds is to do that as a family unit, just like Kayla was saying. And that's been proven time and time again through research, and just seeing that in families as much as we've done this, because it is a very common thing for parents who are deaf to have hearing children. It's actually more common for that to happen, as well as hearing parents that have deaf children. So we understand where you're coming from, and we definitely
be. Do you have any questions about our plan?
No, I really like it. You two definitely made me feel a lot better about my decision, and I'm just ready to get started. I don't want to waste any more time than I already have, and I'm ready.
Yeah, wonderful.
I think our hopes are that for right now that we would want to talk to you about maybe getting the boys into a hearing preschool as soon as we can, and or at least throughout the beginning of the first parts of intervention to see how they're doing. Because I think that having those peers around them would be one of the best options, and then maybe that'll help bridge that gap a lot quicker and easier. Because I mean, as opposed to your family, do they really